And so we have frequent conversations with our son, who's 8, about alcohol and other drugs. And most people might think, 8, you're having these conversations at 8. Oh, yes, we're
I
definitely are.
don't think it's abnormal at all.
Yeah, but I think some people do. They think like, well, we got to
Yeah,
protect children from these
right,
conversations. And
right.
of course, we need to talk with kids at a level that makes sense for them, that they
Yeah,
understand.
right.
But we want to talk with kids early so that when they are faced with these questions themselves, do you want to try a drink? Do you want to smoke some marijuana? Those things that they kind of know what they are. They know that they might be at more risk because there's risk that runs in their family. So the way we talk about this with our son is in the very same way that I my family also has a risk for heart disease,
Mm-hmm.
or cancer. Our family has a risk for substance use disorder, and there are differences that we all come into the world with. And for those of us who are at higher risk, we have to be more careful about our choices. And so we talk about making choices, making safe choices, making potentially unsafe choices around drinking and around use of other drugs. And we start that conversation really early because when it gets to the point that the decisions start to be hard, we want it to be very normal, and just a regular part of conversation so that our son feels hopefully more comfortable to talk with us about, those decisions when it does come to that point.
I love that because it is something that we fear talking about with them at a young age. But these children have been exposed to parents that they've lost because of drugs and alcohol. And so I don't know how you talk about explain why they're gone
Yes.
or or absentee as parents without talking about it to some
Yes.
extent. And I agree it has to be it's careful the way you have to present it to them. But I'd rather it was something familiar than something scary. And oh, we don't talk about that. It's taboo,
That's
you
right.
know.
Because that when we have those taboo messages, kids, and they don't know why, then it can lead to a lot of questions about, is this something I should be afraid of? Is it something I should feel shame about? And if I can't talk about it now, well, if this comes up in the future, then I'm definitely not going to talk about it, right? So these are all kind of messages that we might give to kids in an effort to protect them, that actually
Mm-hmm.
are sending a message that it's not okay to come to us. And we want them to come to us, right? We want to be the
Right,
safe place for them to
right.
explore and think these things through.
And I think it's an exposure that they have at a younger and younger age nowadays.
Yes.
So if a child is looking for comfort and friendship and companionship with someone that's offering them that with drugs or alcohol or any kind of substance, um, then they may tend to lean towards that as a form of self-love or
That's
seeing it as
absolutely right.
self-love,
Yep.
right? That I'm glad that we talked about that. If there's anything that you'd like to share with the audience, um, what would it be about kinship caregiving?
Yeah. I think that it's really, I think it's important to keep in mind that families look different, and that they're going back to the conversation that we had before about how there's no one right way, to be and live a full and meaningful life. I think there's no one right way to be a family,
Mm-hmm.
and that especially when people find themselves in positions that they were not expecting, and roles to love people and support them and care for them in ways that they weren't expecting, that it's okay to have both positive feelings and love, and also to have pain and difficulties that go along with that, and that that's a normal part of the process.
Mm-hmm.
And that they don't have to be alone in going through that, and that it can be really, really helpful to have someone yourself that you can talk with to help navigate those things, and to not kind of maybe keep it inside, or feel guilty if you feel
Mm-hmm.
like, some days I think this isn't really what I signed up for. Um, because it wasn't. And that doesn't mean that you don't love that person any less or are providing any less of a wonderful, wonderful family for them.
Thank you.